Can anyone stand up and read? Anyone?
पुराण सर्पिशास्तिकौ स्यात् अधिमंत पीडितौ स्यन्धा अधिमंत पीडितौ स्वेदयित्वा यथा न्यायं शिरा मोक्षेण
योजयेत्. So Sira Mokshane is there, but where? Dalhana clarifies. Sira Mokshane ityatra Sira Upanasika Lalatya va Apangya va. Upanasika Lalata Apang. Here again, va is there. Va can be or also, can be and also. So remember this sequence for Adhimanta and Abhishanta. Upanasika, Apanga, Lalata. Lalata is 45 degrees from the angle of the eyebrow. Same. So Upanasika, Lalata, Apanga, Va. This is for Adhimanta and Abhishanta. Next. Now, Akshipaka. So, what is Abhishanta and Adhimanta? That you refer. Homework. Yes? So, after reading that, you will come to know about this. Then again, Akshipaka. Sashofascha shofascha dvau pakau yau prakirtitau sneha swedopapannasya tatra vidva siram disha. Again, there is a Siravedana, it is told. Again, Dalhana tells Siraschatra Apangya Aupanasika Lalatyamba. What is the sequence? Apanga Upanasika Lalatya. First sequence was? Yes. So this is in Akshipaka. Akshipaka either it is Sashofa or Shofa. So remember this sequence. This is very important. Apanga, Upanasika, Lalata. There it was Upanasika, Apanga, Lalata. Next. So based on the Vyadhi which we face, like patient comes with, so we should know which is Vedya Sadhya Vyadhi, Netra Roga. So based on that, we will see further with the Karma Lakshanas. So these are Vedya Sadhya Vyadhi, Sirotpata, Siraharsha, Sashofakshipaka, Ashofakshipaka, Anyatovata, Puyalasa, Vata Viparyaya, Adhimanta and Abhishanta. So these are Vyadhana Sadhya Netra Rogas. Yes. Apart from that, we have Drishtigata also. So in this, we should see the sequence again. And in this, we ask patient, especially when we ask patient, what do you see? When it comes to Netra, patient, we should ask patient, what are you seeing? Is it double vision or is it blur? Or is it visible up or below or half side it is visible? So based on what patala is involved, what patala of the netra is involved, the Viddha varies. So we saw Abhishanta, Adhimanta and Akshipaka. So rest all Vyadhis, we basically use formula where based on which patalagata Vyadhi it is. Which patalagata, how to identify which patalagata. So in Drishti Roga Adhyaya or Sushruta Uttara, there are certain shlokas which tell which explains about the lakshanas. So if it is in Pratama Patalagata, such and such lakshanas will be seen. Dvitiya Patalagata, so and so lakshanas will be seen. So that we have to identify. And then we should go for Viddha Agni. Some cases where, like Sira Harsha or any other like Puya Alasa, where there is swelling, we can apply Jalauka too. Directly Jalauka we can apply, so that the Rakta Mokshan is seen and we can see the results. It depends on how we choose which type of Rakta Mokshan we can. Understand? So next. So we'll see Patalagata Roga Lakshanas. So Pratama Patalagata. शिराभिराभि संप्राप्य विगुभ्यन्तरे भृशं प्रथमे पटले दोषो यस्य दृष्टौ व्यवसितम् अव्यक्तानि च रूपाणि सर्वाण्येव. So there is something kept here, but he is not able to distinguish. It is avyakta rupa, alpavyakta or avyakta. So if this is a projector, is like something is kept, but I am not able to distinguish. Patient will come, he will tell like this. He will definitely tell you like this. Sir, ಏನಾದ್ರು ಒಂದು ಇದೆ ಅಂತ ಕಾಣ್ತಿದೆ, ಬಟ್ ಏನಂತ ಗೊತ್ತಾಗ್ತಾ ಇಲ್ಲ ನನಗೆ. That is Prathama Patala. So simple diagnostic method in Ayurveda. Next. द्वितीय दृष्टिभृशं विह्वलितं द्वितीयं पटलं गते मक्षिका मशकान् केशान् जलान् जालकान् च पश्यति. Something fly like structure is going here and there. That is द्वितीय पटल. Mashaka, kesha, some hair like structure is seeing. That is द्वितीय पटल. मंडलानि पताकांश्च मरीचि कुंडलानि च परिप्लवांश्च विविधान् वर्षभ्र तमसांश्च. So how Varshabhra will be there. Similarly, the patient will be seen. दूरस्थान्यपि रूपाणि मन्यते च समीपतः. What is this? हाँ. So whatever it is, it's like a mirror of your vehicle. There is a written over there, no? Objects are seen close to as they are. So similar thing is seen. समीपस्थानि दूरे च दृष्टिर गोचर विभ्रमा. समीप इरोದು ಅದು ದೂರ ಕಾಣುತ್ತೆ. यत्नवानपि चात्यर्थं सूचिपाशं न पश्यति. This is a test. How we do Rennes test, how we do tuning fork test. All those tests we find here. We do Snell's chart test to see which number it is. But this is our Ayurvedic test. We give Suchi, we give thread, ask him to put. If he is not able to put, it is Ditya Patala. Simple. Next. Tritiya Patala Gata. Urdhvam Pashyati Nadhasthat Tritiyam Patala Gati. Urdhvam Pashyati Nadhasthat. He is able to see whatever it is in top, not in bottom. Mahante apicha rupani chaditaniva vasasa. Meaning, yes, when you keep a cloth in front of you and what you see, all the big objects from that through that cloth, how it will be, that is seen like that. So how beautiful it is described, you see now. कर्णनासाक्षियुक्तानि विपरीतानि वीक्षते. So if I ask that particular patient whether you are able to see my nose, he will tell no sir, can't tell, onthara blurriness kantiದೆ. He will not be able to make out where the ears are. Other persons here who is sitting in front of him, all those things. यथा दोषं च रज्यते दृष्टिर्दोष बलीयसा अधस्थिते समीपस्थं दूरस्थं च उपरीक्षते. So all these are the lakshanas. You are understanding this? So based on this protocol, we should categorize any netragata vyadi which are related to drishti, which are related to drishti. Any netragata. Next. चतुर्थं पटलं गतः रुणद्धि सर्वतो दृष्टिं लिङ्गनाशस उच्यते तस्मिन्नपि तमो भूते नातिरूढे महागते चन्द्रिकादित्य सनक्षत्र सनक्षत्रवन्तारीक्षे च विद्युतः निर्मलानि च तेजांसि भ्राजिष्णु च पश्यति. So what is the meaning? Complete loss of vision, but he is able to see nakshatras, Chandrika, Aditya. He is able to see the stars, shining objects. So this is bit deeper. Vyadhi. He is not able to see normal objects, but what it is shining far away, that he is able to make out. Next. So this was Chaturtha Patala previously. This was 4 Patalagata Rogas. Now these are the Lakshanas. So based on this, either it will be Vataja, Pittaja, Kafaja, Sannipataja or Raktaja. So now in Dvitiya Patalagata, it was like from the cloth what we see, the vision will be like that. If the cloth is white, Kafaja. If the cloth is red, Pittaja. Or yellow, it is Pittaja, red is Raktaja. Understood? How we are categorizing? Blackish or greyish cloth, Vataja, Shava, Aruna, Varna. So based on that, treatment, your internal medication varies, your medicines for Kriya Kalpa vary. Whatever Kriya Kalpa you do. So it's not only about Samtabruta Loha, Tripalagrata. No. So based on these dosha categorization, your medicine should vary. In further shlokas, they are telling like that only. Vataja idre itara kanutte. These Vataja Lakshana, you put it in these categories. Pittaja idre, these Pittaja Lakshanas, you put in these 4 categories. Kafaja idre, you take these Lakshana and put in these 4 categories. Kafaja Patalagata Rogas. So we are having 4 into 4, 16 types of Drishti Gata Rogas, permutation combinations if you do. Understood? So now I need a volunteer. Quick. To show points in which Patala, how much, which point we should take. So usually this is the rule. First we should ask patient what you are able to see, and you should diagnose it in which Patalagata Roga that patient is fitting. Marker. Marker. Illi. ಇಲ್ಲ ಪಾಯಿಂಟ್ಸ್ ಅಷ್ಟೇ ತೋರಿಸ್ತೇನೆ. So see the points carefully. So different Patalagata Roga points are different. There are basically 4 points. One is Bhrumadhya, Apanga, Bhrupucha, Upanasika. Bhrumadhya, Bhrupucha, everyone knows. Bhrupucha is tail of your eyebrow. exactly there. Bhrumadhya is in between the, which we saw in Shiroroga. Apanga and Upanasik. Upanasik also everyone knows. Apanga. Apanga is, you know, Apanga Sandhi? Lateral canthus. 2 angulas above. There is one notch. You can feel. Here, there is one notch where there is a depression. That is Apanga point. So, point number 1, point number, you palpate before pricking on Apanga, you palpate on the patient. Point number 2, point number 3, and point number 4. Yes, depression itself. That is the easiest way to identify Apanga. Depression. Just above the one third part of your eyebrow, lateral 1/3, there is one depression. That is Apanga. So, Prathama Patalagata, Bhru Madhya, Bhru Pucha. This is on experience I am telling. What sir had experienced, this is not written in the Samhitas. Bhru Madhya, Bhru Pucha. Prathamagata. Huh? Bhru Madhya, Bhru Pucha. 1, 2. Dvitiya Patalagata. Bhru Madhya, Apanga, Bhru Pucha. Bhru Madhya, Apanga, Bhru Pucha. Tritiya Patalagata. Bhru Madhya, Apanga, Bhru Pucha, Upanasika. Chaturtha Patalagata. We take Lalat. One point was there in Abhishanda Abhimanta Lalat. So we add Lalat in Chaturtha, where there is no drishti, only is seeing some shiny objects. So this is based on the experience what Sir R.B. Gopte sir used to practice. Chaturtha. Huh. Order Chaturtha is same. First 4 and then this. Bhrumadhya, Apanga, Bhrupucha, Upanasika, Lalat. Understood? Confusion? Huh? Lalata is that 45 degrees. So Prathama Patalagata, Bhrumadhya, Bhrupucha. Dvitiya, Bhrumadhya, Apanga, Bhrupucha. Tritiya, Bhrumadhya, Apanga, Bhrupucha, Upanasika. Chaturtha, Bhrumadhya, Apanga, Bhrupucha, Upanasika. Same. Apanga is, there is one depression over here. Just 1/3, lateral 1/3 of your eyebrow, just above there is a notch. It will be usually 2 angulis above your Apanga Sandhi. Bhru Pucha is exactly tail point of the eyebrow. Exactly where the eyebrow ends, that is Bhru Pucha. Understood? Lateral 1/3 of the eyebrow idalla, where the angle is. Usually I am telling. ಅದರ ಮೇಲೇನೆ ಒಂದು ನಾಚ್ ಇರುತ್ತೆ. There is one depression. You can everyone palpate their own Apanga. There is one notch. There will be one notch. Huh? Yes. So in that notch, half vrihi. Usually in that notch, full vrihi goes, but don't put it. Half vrihi. Someone will be having little bit higher, someone will be having little bit lower. It depends. Purusham Viksha. So that's why before pricking, palpate and then prick. Understood? Any confusions? No? ಇದು ನಾಚ್ ಇದೆಲ್ಲ ಒಳಗೆ ಹೋಗ್ತಿದೆ. Ma'am's is little bit lateral side. So exact it is not here. Just here. Just sidal. So everyone will be having a different notch. Wherever there is one pit. There is one pit. If you go like this pressing your forehead, you will get one bump. Imagine you are driving a vehicle on your forehead and there is one bump. Exactly, that is the point. Are you getting? Anyone who didn't get? Anyone who didn't get? Come in. We'll show on them. So here it is this. Exactly this distance will be 2 angulars. Understood? But
That is
Apanga Sandhi, above that 2 angulars. So this is a point of where Apangyam, where they are telling to do Siraveda, we should not do it on Sandhi. We should do it 2 angulars above it.
only rules here at that point, but it's not an Aparanga one.
No. Understood? ಈ ಪಾಯಿಂಟ್ಸ್ ಅಲ್ಲೇ ಮಾಡಬೇಕು. ಮರ್ಮದಲ್ಲಿ ಮಾಡಬಹುದು, ನಾಟ್ ಆನ್ ಮರ್ಮ. Marma, Apanga Marma is Apanga Sandhi Marma. Here we are doing above it. Understood? So this Apanga is seen in Unmada also. If you see the next shloka, I guess next. शंख केशांत संधिगताम उरो अपांग ललाट च. So what does this mean? Now if we are doing for eyes, is it only for eye? Because in Unmad also we are having Apanga, Lalata we are having. What my observation is, brain development, the receptors, wherever the visual receptors or in whatever respective receptors in the brain, when we do Viddha on this point, it will develop. Why I will tell you. So when I had come last month, after the lecture here, I went to see some patients. They were DMD patients, Duchenne's muscular dystrophy. So, what I felt is this patient is going under Pangu, Khanja Pangu, and I was doing Khanja Pangu points. Then, obviously, I am not experienced in that. So, I called sir. So, sir said something different only. He told take Bhrumadhya and take Lalata. Where the Vyadhi is, where he is telling me to prick. Then I went referred what is DMD? Yes, one of the progressive disorder. Yes, which is huh? Immuno autoimmune disease. Yes, where body's brain is only not working. Body cells brain is not working. They are not identifying their own cells. Yes. So smriti nasha. In Unmada, again, smriti is affected. Unmada, apasmara, mainly that is the thing. So there is a development of tissues in brain, receptors, is what I felt. I'm not telling this is only the thing. It is what I analyzed. And when we see in such autoimmune diseases, when you give Medhya Rasayana drugs, it will work. It gives excellent result. Sir told me, if you get pure Shankha Pushpi, give that to the child. Why? It is because of Mamsal. No, I was getting irritated. Why sir is doing like that? It is on Mamsal Dhatu. Why we are giving Medhya Rasayana? Then when we thought in this angle, Medhya Guna of each and every cell is also hampered over. So to bring back that guna in each and every cell, we do this. Sir told 3 months you do that only. Later we will see. Step by step we have to tackle that disease. 3 months only you take Bhrumadhya Lulat. So this is Ayurvedic Sharira. So in this angle we never jump into this angle. Understood? So here most of the time, see, again in Timirakshi Paka Prabhutishu, Lalatyam Apangyam. Here also Lalata Apangyam, here also Unmada Lalata Apangyam. Confusion. Yes or no? You will get doubts. Why again same things we are doing? But there is some slight minute difference. That we have to see. But again, why same similarity? Because there is something going common in between those diseases which we have to analyze. Smriti is not only your Smriti. Smriti is your for each and every cell. If there is no Smriti, then touch sensation you will not be able to feel what you are touching. If there was no Smriti to each and every cell. Sometimes patient comes, sir, ಏನು ನಾನು ಟಚ್ ಮಾಡ್ತೀನಿ ಅರ್ಥ ಆಗ್ತಿಲ್ಲ ನಂಗೆ. Yes, it might be because of brain tissue involvement, but parasympathetic nervous system, that also you should be seeing, because each and every cell will be having that. In Ayurveda we have Shilaputraka Nyaya. If Samhita people will be knowing Shilaputraka Nyaya. So whatever the big structure is having gunas, same will be having in small stones, small entities. So whatever there is in Brahmanda, that is there in Sharira. So whatever there is, it is in Sharira, it is there in minute molecules of the body. Understood? So this aspect should also be taken care of. Yes. Currently, no. I'm doing these two only. And one more thing, I have started doing this in one of my cases in Parkinson's. I am not getting it the result, but definitely I'll get it. I'll share it next time when we meet. Recently, 2 weeks ago, I started. I don't know how it will work, but based on this principle, I have started. Let's see. DMD, one of the patient, I had two kids. One kid, he was already on wheelchair. One kid was in the process of going to that DMD condition. Currently, he is having around 20% of increase in hand grip. Hardly 1 month with her. I had told one of my colleague to do with her on that. If not every day, weekly thrice. If not thrice, twice at least you do. So the parents are telling, this is not from doctor's side. Parents are telling, sir, ಈಗ grip ತುಂಬಾ ಚೆನ್ನಾಗಿ ಬಂದಿದೆ. He is able to write it properly. How he used to write priorly, he is writing. Grip ಎಲ್ಲ ಚೆನ್ನಾಗಿ ಬಂದಿದೆ. He can hold pencil very nicely. Yes, children will cry while pricking, but you should. They give injection and all, why can't we pray? ಅಯ್ಯೋ ಪಾಪ ಅಂತ ಅನ್ಸುತ್ತೆ, ಬಟ್ we should. There is one more case of ADHD. Currently, I am doing this only. Bhrumadhya, Lalat. Now their teachers are telling to their parents, ತುಂಬಾ ಹೈಪರ್ ಆಕ್ಟಿವ್ ಇದ್ದ, ಈಗ ಕೂತ್ಕೋತಾನೆ ಅಟ್ಲೀಸ್ಟ್, ಏನ್ ಹೇಳ್ತಿರೋ ಅದು ಕೇಳ್ತಾನೆ. Internally, what I am getting is Swarna Prashana daily and Shatavari Kalpa with Vacha. Why Shatavari Kalpa? For palatability. Sweet. Vacha is the main drug. Shatavari Kalpa again gives Brahmana action only, nothing wrong in that. That's all. Internally, that's all. And with. So, in this angle, when we see all these points, whatever they have told in this big shloka, we will come to know why exactly they have done. Or else I would have been doing that Pangu points only. Khanja Pangu points, what they have told in this shloka. So I would have not thought about Lalat. Understand? So we can treat other Vyadis which are not told in this based on the principle which are used in this Vyadi. So this is the guidance shloka, this big shloka what I told in initial part of my lecture. This is that big shloka for those who are attending for the first time. So take down the reference if you want. You can go, you can read the tika of this. There is a huge tika. I guess 1.5 page tika on this shloka. Dalhana tika. I am also still learning. I am not a pro. Every day I am getting a new things to learn. Understood? So let's go further. Next. So next few cases I had documented. Rest all cases I just explained you, right? That I didn't get to document. These few cases I had documented. I'll show this. I guess I have 3 cases. One more I had told that vision loss. I will document it once he gets cured completely. Next, see this. Can you see the difference? Before with the complete red. First with the in the morning, whiteness is. Second with the in the evening, still more whiteness was. After that patient got frightened and she went. But one day result, one day without medicine. I asked her, "What are you able to like any vision loss or anything?" She told blurriness ಅಷ್ಟೇ. Blurriness ಅಂದ್ರೆ ಪ್ರಥಮ ಪಟಲ. I asked her whether there is some dot seeing or visible or not. No, just blurriness. ಪ್ರಥಮ ಪಟಲಗತವಿದ್ದ ಅಷ್ಟೇ. ಭ್ರೂ ಮಧ್ಯ ಭ್ರೂ. With that two with the points, so much of difference in one day without medicine. Without medicine. Next. See the three. This is a video. Just play it one by one. This was before Viddha. See, this was morning. So I did Viddha and took this video in the evening. Second evening I did Viddha and took third day morning. I mean second day morning. Hmm?
What are the points here?
Yes, I'll tell. So for Ardhita, usually it goes with trigeminal nerve. Usually it is related to trigeminal nerve. So what happens is all these 4 points of not Tritiya Patalagata Roga, and one more is usually TMJ joint. We take that. Anusandhi Madhyagatam, Apasmara point. We take that. And in Ardhita, best we go for Agni Karma on these points, which Swaranashalaka. Because same point. Most of the time, Ardhita is due to Pravata, Shita Guna. I have seen many cases like patient will tell, I was riding on a bike, wind was came, suddenly one side face got twitched. So it is Shita related one. So better go for Agni Karma. Viddha also works, but not that much. Even
In this case, why was it that way?
this case, I asked the patient, what are you seeing? He was like double vision. So which patala? Dvitiya patala. I asked him, like, is there any issue with it? And again, if there is not issue with vision loss also, we can treat it like an ardhita by taking all those 4 points. And one more, TMJ. Huh? ಒನ್ ವೀಕ್ ಮುಂಚೆ ಸರ್ CT ಸ್ಕ್ಯಾನ್ ಮಾಡಿದ್ರು, ಎಲ್ಲ ನಾರ್ಮಲ್. ಆಮೇಲೆ ಅವರು ಅಲ್ಲಿ ತೀರ್ಥಹಳ್ಳಿಯಲ್ಲಿ ಫ್ರಮ್ ತೀರ್ಥಹಳ್ಳಿಯಲ್ಲಿ ಏನಾಗೋದಿಲ್ಲ ಅಂತ ಹೇಳಿ ಮಣಿಪಾಲ್ಗೆ ಬಂದ್ರು. ವೆರಿ ನೆಕ್ಸ್ಟ್ ಡೇ ವಾಸ್ ಅಬೌಟ್ ಟು ಗೋ ಫಾರ್ MRI ಸ್ಕ್ಯಾನ್, ವಿಚ್ ಇಸ್ ಅರೌಂಡ್ 16,000 rupees. I gave 400 rupees medicine and free with that. He was like second, like after first with the sir, ಏನ್ miracle ಇದು. Doctors had told we have to do minor surgery. What is this miracle you had done? He told me. Currently it is going on. Luckily I got this case few days ago only, 3 days ago. It is going on, not completely cured, but it is going on better. He is telling 50 to 60% I am feeling better. ಆಗುತ್ತೆ, ಅದಕ್ಕೆ ಪದೇ ಪದೇ ಮಾಡಬೇಕು till it gets cured. Along with that, balya medicines are going on till it gets cured. Usually 1 week to 2 weeks max. If regular banda. Apart from that, you can do Shastika Shalipindaswar also, if possible. Pindi.
So how is his double vision now? Like
Is normal. Double vision is gone. Just minute eye drop is there. Minute, you can see. Process is there. Minute. It's almost nil. But when you see keenly, when you observe, it is there. Minute, it is there.
what was the nidana in this case?
Nidana first, his wife is only Parkinson's. What I told. So he had come to Udupi. So to show his wife, he had come visited my clinic. I just saw what happened to your eye ಅಂತ. ಇಲ್ಲ ಸರ್ ನಾಳೆ ಎಲ್ಲ MRI ಮಾಡಬೇಕು. ಇಲ್ಲ ಸುಮ್ಮನೆ ಕೂತ್ಕೊಳ್ಳಿ, ನಾವು ಮಾಡೋಣ ಅಂತ. I just did one sitting and evening I told I'll come again in evening. And he told, sir, what miracle you did ಅಂತ. Again, one more thing. Sorry, I forgot. I did Agni Karma on the same points also. Same points. So this is 2 days result. 1 day result only you see. Same evening. Yes, together. First Viddha, then Agni. Yes, we will. We will demonstrate. Next. I guess those who follow me had seen this reel on my Insta. This last time when I had second seminar, I guess one of the candidate is there here who had observed this. Yes. So Timira, she was not able to see whatever is there on the board. One sitting she was able to see clear. Yes, it will reoccur. That's why we have to do pade, and we should see the nidanas and accordingly treat. You can play this with the sound if possible. Sound ಇದು ಇಲ್ಲಿ ಇರುತ್ತಲ್ಲ, ಮೈಕ್ ಇರುತ್ತಲ್ಲ, ಇಲ್ಲಿ ಮೈಕ್ ಇನ್ನೊಂದು ಇಲ್ಲಿ ಏನೋ ಇಲ್ಲಿ ಸೌಂಡ್ ಆಫ್ ಮಾಡಿದ್ದೀನ ನಾನು? ಇಲ್ಲ, ಫುಲ್ ಇದೆ. ಯಾಕೆ ಬರ್ತಾ ಇಲ್ಲ? ಹಾ ಇಲ್ಲಿ ಇಲ್ಲಿ ಕೆಳಗೆ. There was one board on the wall. So there was one board. On that it was written Salila. Dikshit Sir Clinic. To upload this video on Insta, I didn't show all the points. Immediately, just after the one sitting, she read it. Salilan. So we can work on this area also. Thing is identifying the nidana, identifying the cause, dosha. Yes, with the points will be same. When there is a higher power, go for Chaturtha Patalagata Roga. Higher power.
This individual was suffering from this kind of a vision problem since how many?
Since many years.
Since many years.
She also don't remember actually. Since many years. The thing is, like her power was something 5 or 6. One was 5 and one was 6, something like that. So that much also we can work. Along with all Kriya Kalpas, Anjana, Tarpana, Puttapaka, all those things we can do. If we do 200 to 300 Tarpanas for this particular patient, you will find the result. But along with the we do 50 Tarpanas, we can take out her specs. So that much of cost effective, like cost reduction it makes, that much of faster results it shows. We have retinitis pigmentosa patients in Sur's clinic. They come. It takes long time. Long time is it takes 1 year, 2 year, but it cures. Patient should also have patience. Doctor should also have patience. Along with that, do shodhana, give basti, do tarpana. Patient will tell you. One patient had come from America for her vision loss, retinitis pigmentosa. Did all the panchakarmas along with Viddha karma, 6 months she got her visions. Obviously, Nidanas all were seen. Nidana Parivarjana was there. All those were there. Strict Pathya was followed. But she got the vision. Imagine giving a vision to a blind person. How it will be. One thing you should know where and how to prick. You should be able to categorize in what stage it is. And then do. If we go see the reports and then do, I'm sorry. Ayurveda will say, I'm sorry. I can't work like that. Beautifully, they have told how to categorize a patient, in which category. So beautifully, easy, simple methods. If our Shalakya OPD runs like this, will it not be wonderful? Will it not be a wonderful thing? Even there is a regeneration of tympanic membrane. Perforation ಇರುವಾಗ tympanic membrane regeneration ಆಗಿದೆ. Younger the generation, faster the recovery. Tympanic perforation ಅಲ್ಲಿ ಕೂಡ ಕೆಲಸ ಮಾಡುತ್ತೆ. We have seen before and after reports of a same person. So if a young kid or young person comes to you, the recovery is more. If old age people come, recovery is there, but it takes a long time because dhatu kshaya state they are in after 50, after 60. It is into the terminal stage. Recovery will be there, but late. We have to give rasayanas, we have to do panchakarma, all those things we should do for them, must and should. Along with that, this. But in young age, recovery will be faster. One more guy is there in sir's clinic, patient. Not apart, I'm deviating. So, if a person had a fall, he is on a wheelchair and he is not getting up. So, how will be his mamsa status, tonicity, all that will be reduced, right? But one guy is coming daily to sir's clinic. He had fallen from a nerle tree, jumbo tree. From here, no sensation. But his muscles you should see as if he is going to gym. This is power of Viddha. It will not allow the further progression of the disease. Results are secondary, but further progression. If that person was sitting quietly in that particular wheelchair, obviously we will also see the condition where people put plaster on fracture. See, after 1.5 months, that hand or limb will be smaller than other limb. So in that condition, it is there in 1.5 months. This is from 5 years. His mother is devoted. He is like, तू टेंशन मत ले, मैं लेके जाऊंगी तुम्हें. Every day morning, every day evening. Morning 12 o'clock they will be there. Night 10 o'clock they will be there. Sir's clinic. They do Vidya, they go. In some 1 to 2 months ಮಧ್ಯದಲ್ಲಿ we do Shastika Shale Pinda Sveda, we do Abhyanga. We students do. Now he is getting some sensations, like while going for urination, he is understanding that he is urinating. Now, after 5 long years. But improvement is there. Don't get tired too fast. Lage raho. Thing is that, and convincing the patient. If you treat one such patient, no, you will have lines in your clinic. Khandita. I told no 2 hair fall patients. One got me, other one. Now he also told, that ptosis patient also told, sir, ಈ ತರ ಸುಮಾರು ಜನ ಇದ್ದಾರೆ, ನಾನು ಕರ್ಕೊಂಡು ಬರ್ತೀನಿ ಅಂತ. From Tirthalli. It's around, I guess, 50-60 kilometers from my clinic. One single patient you should hold on to, stick on to that, convince that patient, give your 100%, show that result. Like I told last lecture, ज्यादा से ज्यादा क्या होगा, पेशेंट मरेगा, वो उधर भी मरने वाला है. You give your 100%, stick on to them. Yes or no? You stick to them like a leech. Unless that Dushita Rakta is not taken out, you stick to it. Understood? So that's what is necessary in the field of Ayurveda. Why there were no emergencies in 2000, 3000 years ago? Next day they were going for war. If they are injured today, next day they will go for war. That fast it was. We are not learning according to what Ayurveda is telling to us. That's our mistake, not Ayurveda's mistake. Yesterday, while I was supposed to shut my clinic at 5:30, I had some work. I had to do some presentation. I was sitting and doing. I got two patients. One was asthmatic attack. She came like that only. She came in my clinic. First, without any other second thought, I did Shwasa with her. She calmed down. Then she told, "Sir, ಈ ತರ ಆಗ್ತಾ ಇದೆ. ಸುಮಾರು ದಿನ ಆಯ್ತು." She got relieved immediately after picking. Then after that, she went again. I guess 7:15. One of two ladies came to my clinic, mother and daughter. Daughter was like, "Sir, appa biddidru. He is not faster effect." As I told yesterday, suddenly he stood up. Yes, he could not run or walk as previous thing because it might be having fracture. He might be having fracture. There was so much of pain it is there then. So he needs immobilization over there. Viddha karma can be done every day, unlike Rakta Mokshana. It can be done in pregnancy. It can be done in babies, starting from day one. Every Ayurvedic Vaidya should learn this. These are motto. My motto, Sir's motto, and Sir's students. Because this will boost up your practice. Boost up. One more. Two weeks ago, one more patient I got. He had a fall accident. He had an accident some 7 years ago. He told, sir, ಬೇರೆ ಎಲ್ಲ ನೋವಾಯ್ತು, ಇಲ್ಲಿ ಅಷ್ಟೇ ನೋವಿದೆ. Where there is a tendon on patella, lower angle of patella. I just did Shipra on both the legs. I told, now you see palpitation. Sir, ಇಲ್ಲ ಸರ್, ಹೀಗೆ ಮಾಡ್ತಿದ್ದಾನೆ ಸರ್. ಇಲ್ಲ, ನಾವು 7 years ago he had a fall. No swelling, nothing, just one Viddha. I told him all the reasons. He used to travel a lot. I told him this might be the reason why you are still having that pain. I told him everything and then educated and then sent. But pain reduce. First thing patient needs is to reduce the pain. Whatever it is. If kidney stone also, he needs that pain to reduce. Where that is secondary, that kidney stone should come out or not, that is secondary. If he wants, he can preserve it in his body also, but he should not have pain. That is one biggest thing. Okay, shall we end?
ಕ್ವಶನ್ ಅಂಡ್ ಆನ್ಸರ್ ಸೆಷನ್ ಇರುತ್ತೆ, ನೀವು ಕೂತ್ಕೊಳ್ತೀವಿ. ನಾನು
ಓಪನ್ ನೆಕ್ಸ್ಟ್ ಲಾಸ್ಟ್ ಸ್ಲೈಡ್ ಓಪನ್ ಮಾಡಿ. ಲಾಸ್ಟ್ ನೆಕ್ಸ್ಟ್ ಮಾಡಿ.
Now the session is open for question and answer. We will have at least 30 minutes for question and answer. So I will start with one question here. Uh, this question is not directly to which point in which this is. Usually in our clinical practice, to ask the patient to come for 7 days or 8 days to get it done Basti Karma or any other procedure, itself we are finding very difficult. And just Viddha Karma is just a 30 seconds procedure for you, especially those who are expert. We may need some time to at least locate the point and then do Viddha Karma. First thing is how actually you convince the patient to come on regular basis. For some patients daily, or some patients twice in a day, that too 8 days, 15 days, etc.
So first thing is, as soon as we do with the karma, like first how to convince them. So we'll tell injection kodla, but we won't put anything. Then first thing will be like, sir, no agutta. ಇಲ್ಲ ಸೊಳ್ಳೆ ಕಚ್ಚಿದಂಗ ಆಗುತ್ತೆ. That much you can tolerate ಅಲ್ವಾ, but this big no will come down. We will tell. We'll tell with the confidence that okay, ಕಮ್ಮಿ ಆಗಲಿಲ್ಲ ಅಂದ್ರೆ ಬರಬೇಡಿ. If you are confident enough, you are diagnosed it as Shipra point disease, you do that because that is the most easiest yet difficult. Okay, be accurate. Okay, but it is easy comparatively. Comparative to this, all those things, confusion things, that is easy. So we will tell like that. ಆಗಲಿಲ್ಲ ಅಂದ್ರೆ ಬರಬೇಡಿ, ಕಡಿಮೆ ಆಗಲಿಲ್ಲ ಅಂದ್ರೆ ಬರಬೇಡಿ ಅಂತ ಹೇಳಬೇಕು. Okay, sir, madona. Somehow they will be convinced, and they can't escape from there. Usually, when patient is in your cabin, they can't escape. So, first sitting you will do anyhow, but in first sitting only you will get. They will feel, oh, pain hogide. Then you tell. So, itara we have to do repeatedly. ಈಗ ಹೋಗಿದೆ ಮತ್ತೆ ಬರ್ಲಿಕ್ಕೆ ಚಾನ್ಸಸ್ ಇದೆ, ಬಟ್ ಈ ತರ ರಿಪೀಟೆಡ್ ಮಾಡಿ ಮತ್ತೆ ಅದರ ಜೊತೆಗೆ ಮೆಡಿಸಿನ್ಸ್ ತಗೊಂಡ್ರೆ, ಇಫ್ ದ ಪೇನ್ ಈಸ್ ಏಬಲ್ ಟು ಗೋ ಇನ್ 2 months, ವಿ ಕ್ಯಾನ್ ಟ್ರೈ ಇಟ್ ಫಾರ್ 20 days to 1 month. ಈ ತರ ಹೇಳಬೇಕು. ದೇ ವಿಲ್ ಡೆಫಿನೆಟ್ಲಿ ಕಮ್. ಓ, ನಾವು ತುಂಬಾ ದೂರ ಇದ್ವಿ, ಅಟ್ಲೀಸ್ಟ್ ಕಮ್ ಥ್ರೈಸ್ ಆರ್ ಟ್ವೈಸ್ ಅ ವೀಕ್. ಇಲ್ಲ ಸರ್, ತುಂಬಾ ಕೆಲಸ ಎಲ್ಲ ಇರುತ್ತೆ. ಓಕೆ, ಐ ಆಮ್ ದೇರ್ ಸಿಟ್ಟಿಂಗ್ ಹಿಯರ್ ಟಿಲ್ 8 o'clock, 9 o'clock in my clinic. Come that time, but come. You should show that you are also craving to subside that disease, subside that problem. ಓಕೆ, ಆಯ್ತು ನೋಡೋಣ ಆಮೇಲೆ ಅಂತ ಹೇಳಿದ್ರೆ, ಯು ಶುಡ್ ಆಲ್ಸೋ ಕ್ರೇವ್. ಯು ಶುಡ್ ಶೋ ದಟ್ ಕ್ರೇವಿಂಗ್ ದಟ್ ಯು ಆರ್ ready to subside that pain in him. Every action has equal and opposite reaction. In first initial practice, you should talk more than do with the karma. Later, patients will only come. As we tell now, when we do seva in Wari, Pandharpur Yatra, they tell, sir, ಲಾಸ್ಟ್ ಇಯರ್ ಮಾಡಿರೋದು ವಿದ್ಧ ಕರ್ಮ ಅಗ್ನಿ ಕರ್ಮ ಇನ್ನೂವರೆಗೂ ಪೇನ್ ಬರಲಿಲ್ಲ, ಈಗ ಇಷ್ಟು ಎಲ್ಲ ನಡೆದಿವಿ ಅಲ್ಲ, ಅವಾಗ ಸ್ವಲ್ಪ ಪೇನ್ ಮಾಡಿದೆ ಚುಚ್ಚಿ ಅಂತ ಹೇಳ್ತಾರೆ. ಅಂಡ್ ದೇ ವಿಲ್ ಟೇಕ್ 10 more people and come. So when you give reasons, they will come. And one more thing, I personally do it for free. We students of Chandrakumar Deshmukh sir do it for free. Suvarna Shalaka Agni Karma, and even with the karma. Doesn't hardly cost anything for us. When you do that, they will come again because it is giving result and you are not charging also. That is optional. I left it to you. I leave it to you. Some people charge for per prick 200 rupees also. So much complexity, so much prick, so much bill more. There are people. But what I feel, how much we need, we should take that. So ಒಂಥರ ಸೇವೆ ಮಾಡೋ ತರ ಆಗುತ್ತೆ ನಮ್ಮ ಕೈಯಲ್ಲಿ. There is a rule, no, in Ayurveda while doing practice, we should do seva also. So ಆ ತರ ಮಾಡೋ ತರ ಕೂಡ ಆಗುತ್ತೆ. But it's up to you. I leave it up to you. No comments on that.
Usually
whenever patient comes or when we do the treatment, by doing this, if I give kashaya, it does dosha shamana. When I do panchakarma treatment, we tell that we remove the dosha out of the body. Or this is a case of avarodha. By doing this treatment, avarodha is removed. So exactly what happens when we do Viddha karma? Is it that dosha shamana, removal of avarodha, or shodhana? Or have you thought in these lines?
So one thought what I have is, so we do like Viddha based on marma points. Marmas are concentric points of prana, where prana is more concentrated in these points. So see, now we have to go to Delhi. Better we will take flight to reach earlier. Similarly, marmo points are those points through which we send the signal, it will go ashu very quick, very fast. Because marma is a junction of sira, snayu, asti, sandhi. All those complexity will be there. So based on what type of marma it is. So ಈಗ ಪೇನ್ ಇದೆ ವಾತರಕ್ತ ನೀವು ಡಯಾಗ್ನೋಸ್ ಮಾಡಿದ್ದೀರಾ ಅಥವಾ ಏನಾದರೂ ಒಂದು ಪಾದದಾಹ ಪಾದಹರ್ಷ ವಿಸರ್ಪ ಡಯಾಗ್ನೋಸ್ ಮಾಡಿದ್ದೀರಾ. So it should be quick. So Kshipra Marma, name is only Kshipra. And based on what quality of that Marma is, based on that if we prick, it will immediately go. This is one of my observation. In modern what it happens, I really don't know. Similarly for Agni Karma also.
Similarly, in many neuromuscular conditions, we do abhyanga, lepa, sweda, etc. So, should we directly go for Viddha karma, or is it better to do first abhyanga sweda, and then Viddha karma? Have you seen any difference?
Yes, Viddha Karma, as I said, someone asked in the break that there is one question. So, I guess in morning I told some Janushandhi Gatavata, if we are not getting results after doing Viddha Karma also, try giving Abhyanga, try giving Sveda, and then do Viddha Karma. Usually Gopesh sir used to do this, sir. Like he will be having that one bottle, any Taila, Dhanvantaram Taila, Sahachara Tidala, Narayana Taila, he will be having 100 ml bottle on his table. If that much severity is there, he will take Taila there and there itself. He will tell, keep your leg here. He will do massage, do with the scent. So obviously, Snehana Svedana gives much more better result in whatever way it is. Is it one part or whole body, whatever way it is, it will give much more better result.
Morning we were speaking about the point for thyroid. If there is no goiter or no swelling at all, just in report we are seeing the abnormality, or other thyroid problems are there. In those condition, Viddha karma, does it help?
Sometimes it works along with medicine. That
Again, the points will be same point.
But again, what is the nidana causing that thyroid? Some people will be having so much of tension. Some people will be having some other nidanas. So based on that,
okay, if suppose lots of stress is there, then you take those points.
So usually when there is a stress, Bhrumadhya, Kapala or Shankha, I will not put my hand there because it is too much complicated. We will see someday later. Because Shankha is such marma where all our indriyas are connected over there. It is a hub. It is too much complicated in that. So remember this one point for now. Shankha is that point where all our indriyas, all the wires from all our indriyas are anastomosed in that particular area. So based on we need initially at least we need frequency.
This was one case, sir. Another one, there is ligament tear, joint ligament tear, and that is one case. Another case is the synovial fluid is completely gone in MRI. The two joints touch each other when the person walks. He is old also. So in such cases where the synovial fluid itself is not there, or when there is ligament tear, will Viddha karma and Agni karma help such people,
Yes,
or only Viddha?
both in this synovial, both actually Viddha karma and Agni karma will help. But where there is absence of synovial fluid, there you have to take 6 points of Janu, as I explained last time. 6 points because it is degenerative. Whereas in this ligamentum tear, you have to take Vata Rakta first, Shipra first, and then Janu. Sometimes Gridrasi also, if the person is limping and walking. So Gridrasi. These points you should take along with Agni Karma on those points. Janu basically.
How frequently can we do Agni karma?
Ligament tear, I have not personal patient, but I had seen in Sir's clinic. He was a sportsman, cricketer. He had dived to catch a ball. He got his ligament tear. So on the first day he came along with the assistants. We did Kshipra, Jano, Viddha and Gridrasi. Along with that, we did Agni Karma and other treatments later after the